Sarah. My name's Maddie. I'm going to be your nursing student today. Could you please tell me your name and date of birth?
Sarah Miller, 9/22 of 97.
All right, thank you, Miss Sarah. Okay, today I'm just going to do a quick assessment on you. Is that all right?
How quick?
About 10 to 15 minutes.
All right.
All right. Is it okay if I get your vital signs real quick?
Oh, yeah.
All right. I just need to take your temperature, make sure it's underneath your tongue. Great, thank you. And then I would get your pulse along with your respirations, and I would count that for 30 seconds and multiply it by 2. I want to make sure I get your blood pressure. I would also make sure to get your SpO2 if at all possible. All right. Miss Sarah, are you having any pain today?
Nope. Just a pain in my butt.
Oh, I get it. Kids. No, I'm just kidding. All right. Now I'm just going to listen to your breath sounds and your heart sounds, okay?
All right.
Deep breath in through your mouth, or deep breath in through your nose, out through your mouth, please. Thank you. Perfect. Listen to your heart. All right. Have you had any pain in your breast at all, Miss Sarah?
No, I haven't.
Okay. Any tenderness? Any inverted nipples? Anything?
Nope.
All right. And normally I wouldn't do this in person, but since I have a mannequin, I'm going to feel her breast or palpate her breast. All right. I'm gonna listen to bowel sounds now. Is that okay, Miss Rita?
Yeah.
Miss Sarah?
Oh my gosh! You already forgot my name.
I know. I think I just get confused. You know.
Oh, my sister Rita. She was here earlier.
Yeah. You two. Are you two twins?
Oh yeah.
You look like it. I am listening to your bowel sounds in all 4 quadrants. They're present and active. Do you remember the last time you had a bowel movement, Miss Sarah?
Oh, it was this morning.
Good. Good. Okay. And are you passing gas with that?
Oh yeah.
All right. It's good. And it's just important to remember to continue getting up and moving. Continue drinking those fluids, drinking water especially, and eating high fiber foods. It's just important to keep that going to prevent constipation, just because sometimes the drugs that are given during childbirth can cause constipation. Not all the time, but it's just something to have in the back of your mind, you know. All right, I'm going to put some gloves on, Miss Sarah. All right, and then I'm going to check your uterus, okay? When was the last time you voided?
I think it was a few hours ago.
Okay, did you change your pad around that time too?
Yeah, it was about 2 hours ago.
Okay, all right. And now that I'm feeling your uterus, Miss Rita, I notice that it's firm. It is midline, so no deviation to the left or right. I notice too that it is 2 finger breaths below the umbilicus. That's to be expected. If you ever notice that you're just bleeding too much, it's okay to go ahead and massage your uterus right here, and it'll help firm that up and help clamp that up, contract it, make sure that it's not bleeding as much. All right, now that I have my gloves on, Miss Rita, I'm gonna assess your lochia or your bleeding, if that's okay.
Oh yeah.
So I just need to look at your under and look at your pad. Okay. I noticed moderate bleeding, but you said you changed your pad a couple hours ago?
Yeah, it was about 2.
Okay, that's good. We want to make sure that we're changing that as much as every time we go to the bathroom. Just
why? That's wasting.
I know, it seems like wasting, but it's not always wasting. We want to keep any means of infection away, so any way of infection, because sometimes if we just leave that there, it can lead to infection. Also, it can give us a off assessment just because we can notice there's a lot of blood on there, but if you've been wearing it all day, there's going to be a lot of blood on there.
Oh, that makes a lot more sense.
So I noticed you have moderate bleeding, but I'm going to divide that in half, so you have scant bleeding, so that's normal, that's to be expected. It's red, it's rubra, so that's lochia rubra, which is normal finding. I don't notice any foul odor, anything like that. Did you happen to have an episiotomy when you were giving birth, Miss Sarah?
I think so.
Oh, okay. I'm gonna have you roll to your side then, if you don't mind. And I have gloves on, I promise.
Sorry, I just don't feel like putting in much effort today.
I understand. If I just had a baby, I don't think I would either. All right, and what I'm going to look for is I don't see any redness. I don't see any edema or swelling. I don't see any bruising. I don't see any discharge. I notice that the edges are approximated. That's good. That's what we want to see. I see too that you got an epidural. Little red dot, that's normal to be expected. I'm going to check for hemorrhoids. A few hemorrhoids, that's normal after birth and just after pregnancy even. It's normal to have hemorrhoids just because there's so much pressure in your perineal area from the baby, the weight of the baby, that it can cause those hemorrhoids.
Okay.
All right. And now, Miss Sarah, if you don't mind, I just want to take a look at your legs. Is that okay?
Yeah.
Have you had any pain in your legs recently? Any hot spots?
Well, I did push for quite a few hours yesterday, but other than that, no.
Yeah. Are your legs just feeling sore, like from the pushing, or?
Oh yeah, nothing
like,
crazy.
No sharp pains or anything.
No.
Just because sometimes if there's a nice sharp pain, that can mean that there's a clot in there, and we want to not have that. So if you notice any pain that's unusual, let us know. Just because it could be a sign of a blood clot. We want to watch for swelling in the legs, which your legs look normal, even, symmetrical. I don't notice any edema. That's good. That's not a sign of a blood clot. All right. And I noticed too, Miss Sarah, you're in a very pleasant mood today. You're very talkative, pleasant affect today. It looks like you're doing great, Miss Rita or Miss Sarah. If there's anything you need for me to do for you, you just let me know. If you would have had a C-section, Miss Sarah, I will let you know. I normally would check your IV site. I would check for any drainage, any signs of any infiltration. You would have a catheter in place, so I would check your catheter, make sure everything with that is okay, that urine is flowing okay, no kinks. Check urine for the clear yellow urine color, no foul odor. I would also check your incision site. I would make sure that there was no dehiscence or no separation of the stitches or the sutures. I also would make sure that if there was just a bandage on there, that the bandage was dry and clean and intact.
All right.